First edition begins this half hour marking September. It is National Suicide Prevention Awareness Month. The CDC reports in 2022, Texas led the country in suicides with more than 43,000 deaths. 3 News reporter Madeline Salinas joins us live in our newsroom with what you need to know about battling mental health. Madeline.
John Thomas, while it may be hard, may be difficult to have conversations around mental health, Corpus Christi psychiatrist Dr. John Lucen says asking a simple question can make a loved one who's struggling feel seen. In 1997, Clark Flatt lost his 16-year-old son Jason to suicide. Jason was described as a kid who was smart, loved sports, and had a lot of friends. The same year he lost his son, Flatt founded the Jason Foundation, a nonprofit whose mission is to prevent youth and young adult suicides by offering educational programs for parents, their children, and educators.
What we wanted to do is provide these educators, the school personnel, school staff with the same trainings to recognize changes in behavior for the young people that they see on a daily basis. If everything we've done over the past 27 years has saved one life, it'll be worth it, especially if it's your son or your daughter, the kid in your classroom or the kid next door.
Psychiatrist Dr. John Lucens with Corpus Christi Medical Center Bayview says depression, which can lead to suicidal ideation, can manifest differently in adults than in kids. Classic symptoms in adults include verbalizing thoughts of hopelessness, guilt, and worthlessness. It can even cause physical pain.
You see kids doing things like isolating more from friends, not participating in their sports and slipping in their academic performances. It's what we have sometimes called the silent epidemic in children.
Dr. Lucen says it's important to step in and check on your loved ones, child or adult, if they ever show signs of depression or suicidal ideation.
Common misconceptions are that if you talk to somebody that is suicidal, then that's going to make them more suicidal. That's going to then give them another reason to then commit suicide, and that's not true. Sometimes when you just ask that question, is everything okay? It's too global, it's too vague. So we try to say, how are you today? And ask those sometimes uncomfortable questions, but it's better to ask now than to not be able to ask later.
Now, if you or someone you know needs help, you can call or text the National Suicide and Crisis Hotline at 988. We'll also have a full list of local resources on our website at KIITV.com. John Thomas.
Thank you so very much, Madeline.